Hi, my name is Monica Moore. I'm a registered dietitian and a University of New England master's candidate. Today I'm going to talk about my systematic review for the Uni Capstone project for August 2020, titled The Effects of Thiamine Supplementation on Lactate Levels and Mortality in Critically Ill Adults with Sepsis in the Hospital Setting. We're going to talk about an introduction, objective, methods, the literature review and results, discussion, conclusions, and implications for practice. Before we dig into the literature, it's important to know what thiamine and sepsis are. Thiamine is a water-soluble vitamin, also known as vitamin B1. It can come from food or from supplementation. The recommended daily allowance for thiamine is 1 to 1.2 milligrams per day. It's typically stored in the liver. However, it's stored in small stores, so deficiency can be prevalent. It's affected by SIRS, which is the systematic inflammatory response system, and also by other forms of critical illness. Deficiency can lead to Korsakoff syndrome, Wernicke's encephalopathy, and other neurological issues. In 2014, a hospital ICU study found that 71.3% of their 180 participants were thiamine deficient at admission. Other studies have ranged from 10 to 35% deficiency at baseline. Additional studies suggest that there is a 50% increase in mortality in critically ill patients with thiamine depletion. Sepsis is an indicator of critical illness in hospitalized patients. It may lead to septic shock. It's a common cause of mortality in critically ill, and it's associated with elevated lactate levels. Guidelines for diagnosing sepsis were recently modified to include lactate of greater than 2 millimoles per liter, which was lower than the previous threshold of 4 millimoles per liter. Elevated lactate levels seen in septic critically ill patients were shown in the Surviving Sepsis Campaign database and other studies to significantly increase mortality when over 2 millimoles per liter. Diagnostic criteria for sepsis include SIRS, which again is the systematic inflammatory response system, fever, elevated heart or respiratory rate, elevated white blood cells, altered mental status, edema, hypotension, and vasopressor use, lactic acidosis, and hyperlactatemia. When we look at thiamine and sepsis together, there is a connection. Previous studies have looked at this impact, and current trials running with vitamin C and thiamine supplementation as a combination therapy on serum lactate levels are proving some interesting results. Thiamine supplementation may also possibly lower lactate levels and thus sepsis mortality by increasing time to resolution and improving overall outcomes. That connection is what leads us to the objective of this systematic review, which is to evaluate the effects of 100 to 300 milligrams of IV thiamine on lactate levels and mortality in critically ill septic adults in the hospital. Inclusion criteria for this review included age 18 years or older, hospitalized, diagnosis of sepsis or septic shock, elevated lactate levels, critical illness, and the studies were of various design. Designs included in the review were randomized controlled trials, prospective studies, retrospective studies, and observational studies. No studies were included with less than 10 participants, and the range of publication years was 2014 to present, although a few positive graded studies from earlier were included. English was the chosen language for the articles. The exclusion criteria listed here were ages younger than 18, non-hospitalized patients, those that had end-of-life goals or comfort measures only code status, and those with less than 10 participants in their study. Studies that were still in process without results yet, or those not written in English, were also excluded, as well as those that were systematic reviews themselves. The database search included PubMed, Biomed Central, and clinical trial registration sites. Keywords that were used included sepsis, thiamine supplementation, critical illness, lactate, thiamine, and hyperlactatemia. This PRISMA 2009 flow diagram shows how 130 articles were identified through the database search, resulting in 117 articles to screen after duplicates were removed. 97 articles were excluded due to animal subjects, pediatrics, non-hospitalized, abstracts only, systematic reviews or case reports, and some other issues. After eligibility screening, 18 articles remained and were evaluated in the systematic review. Of the 18 articles that were included, 7 were randomized controlled trials, 3 were prospective studies, 5 were retrospective studies, 2 were observational, and 1 was therapeutic. All studies included IV thiamine supplementation as an intervention, either solely or as a combined treatment, and included an outcome of either serum lactate or mortality. Grades were assigned based on the Academy of Nutrition and Dietetics Evidence Analysis Library Quality Criteria Checklist Guidelines. 15 of the articles included were positive graded, and 3 articles were graded as neutral. Negative graded articles were excluded from this review. So now on to what the literature says. I'll discuss briefly each article, and then we'll go through the discussion and conclusion pieces. Byerly et al. In 2020 was a therapeutic retrospective study that evaluated the effect of vitamin C and thiamine on mortality and lactate clearance in the ICU. 11,330 adults participated. The treatment group consisted of vitamin C only, thiamine only, or both vitamin C and thiamine supplementation. The control group had no supplementation. Overall mortality was found to be 25.9%, and an association between vitamin C and or thiamine and mortality was seen. Sadaka et al. In 2019 was a randomized controlled retrospective cohort study that studied the use of ascorbic acid, which is vitamin C, thiamine, and steroids in septic shock patients. 62 adults participated in the study. The treatment group consisted of IV vitamin C, 1.5 grams every 6 hours for 4 days, IV hydrocortisone, 50 milligrams every 6 hours for 7 days, and IV thiamine, 200 milligrams twice daily for 4 days. The control group received no supplementation, but just the standard of care. In this study, the intervention group, which was the supplemented group, was found to have significantly lower ICU mortality and hospital mortality than the control group. Woolham et al. 2018 was a retrospective single-center matched cohort study. It was used to determine if critically ill patients with septic shock exposed to thiamine would see improved lactate clearance and outcomes. 1,049 adults were participating in this study. The treatment group got IV thiamine anywhere from 100 to 500 milligrams as a one-time dose, and the control group got no IV thiamine. Thiamine administration was found within 24 hours to be associated with improved lactate clearance and the reduction in 28-day mortality. Danino et al. In 2016 was a randomized double-blind placebo-controlled study, which is the gold standard for study designs. They looked to determine if IV thiamine would reduce lactate in septic shock patients. Of the 88 adults that they had in their study, half were in the treatment group receiving IV thiamine 200 milligrams twice daily in 50 milligrams of D5 over 7 days. The placebo group received just the D5. They unfortunately found no significant difference in lactate levels at 24 hours between the thiamine and the placebo groups. However, they did see a 44% lactate change in the thiamine group versus a 20% change in the placebo group. So even though it was not significant, there was still a difference. 35% of the patients, which was 28 of them, were also found to be thiamine deficient at admission, which was interesting. Hemming et al. In 2020 was a prospective observational study used to assess the relationship between thiamine, lactate, and clinical outcomes in septic patients. 28 adults with sepsis in the ICU were included. There was no treatment or placebo groups. No correlation was found between total thiamine and lactate concentrations or the different types of thiamine and lactate. The effect of thiamine and thiamine diphosphate, however, were lower in non-survivors than they were in survivors. Another Danino et al. Study, this one in 2010, utilized a prospective observational design to determine the prevalence of thiamine deficiency in critically ill adults with sepsis and the association between thiamine levels and lactic acidosis. 30 adults that had lactate between 3 and 4 millimoles per liter and suspected infection and sepsis were included. They looked at the ICU admissions compared to the ER admissions as their control group. 10% of patients were found to have thiamine deficiency at admission, and another 10% were seen to have thiamine deficiency after 72 hours. No correlation was found between lactic acidosis and thiamine, but a positive correlation was found between thiamine and liver transaminases and lactic acidosis. Casserly et al. In 2015 was an observational analysis. They looked to obtain serum lactate within 6 hours of admission for patients suspected of sepsis or septic shock. 28,150 adults were looked at for this study, and 19,945 were included because they had lactate levels drawn. Lactate over 4 millimoles per liter were included in the study. There was no treatment or placebo groups. Significantly higher mortality was seen at 44.5% in patients with hypotension and lactate over 4 millimoles per liter, which is that sepsis group. Significant mortality increase was also seen with lactate over 2 millimoles per liter. In Moskowitz et al. 2017, a randomized double-blind placebo-controlled trial, they tested if thiamine supplementation improves kidney injury during septic shock. 70 adults with sepsis and lactate over 3 millimoles per liter were included. The treatment group got IV thiamine 200 milligrams in 50 milliliters of D5 twice daily for 7 days, and the placebo group received just the D5. More patients in the placebo group were started on renal replacement therapy and also had worse creatinine levels compared to the thiamine supplemented group. Moskowitz et al. In 2014 was a prospective observational study looking to explore whether thiamine deficiency is associated with elevated lactate in patients with DKA, which is diabetic ketoacidosis. 32 adults were included without any treatment or placebo groups. 25% of the adults were found to be thiamine deficient at baseline. Median lactate levels in thiamine deficiency and thiamine sufficiency were significantly different. 50% of the patients had lactate greater than 2.5 millimoles per liter. Statistically significant inverse association between lactic acid and serum thiamine was found. Falder et al. In 2010 was an observational cohort study used to examine the levels of thiamine in burn patients as well as the effects of thiamine supplementation on levels of serum B1, pyruvate, and lactate. 20 adults were included in the study. The treatment group received IV 100 to 200 milligrams of thiamine, where the control group received no thiamine supplementation. A significant association between thiamine supplementation and serum thiamine levels were seen. A significant interaction between thiamine levels and time was seen, and an increase in serum thiamine associated with a decreased lactate level was also seen. More specifically, 1 nanogram per milliliter increase in thiamine resulted in a decreased lactate of 0.016 nanomolar. Heron et al. In 2019 was a prospective randomized controlled trial that assessed the effectiveness of IV thiamine in reducing hyperlactatemia and septic shock. 65 adults included in the study with septic shock and lactate over 2 millimoles per liter. The treatment group received IV thiamine 200 milligrams 3 times a day for 3 days, and the placebo group received only the normal saline 3 times a day. No significant differences were found related to lactate and mortality or lactate reduction over time. In Mitchell et al. In 2019, it was a retrospective study that examined the effects of vitamin C, thiamine, and hydrocortisone on reducing hospital mortality. 76 adults participated in the study. The treatment group received IV vitamin C 1.5 grams every 6 hours, thiamine 200 milligrams twice daily, and hydrocortisone 50 milligrams every 6 hours, 100 milligrams every 8 hours, or 10 milligrams per hour. The placebo group received only the hydrocortisone. Hospital mortality did not differ significantly between groups. The ICU 28-day and 60-day mortality rates were not different, but the ICU length of stay was significantly reduced in the treatment group.